Welcome to the Aesthetics Unfiltered Podcast. We are Michelle Jones and Melanie Torres, two leading medical aesthetic nurse practitioners and great friends based in California. We uncover the inner workings of the booming aesthetics industry from both the patients as well as the providers' perspectives.
Join us for the authentic conversations about current and trending treatments, best practices, and the real issues people face with modern beauty standards. Any information or advice given is general in nature. You should consult with a healthcare provider before undergoing any treatment.
Hey everyone, we have Melanie back and she is back in action. So it's just like the old times. And today we have we're just going back to basics, but the questions keep changing for patients. So we are going over the most common questions for the next 30 minutes. And hopefully this is helpful for the patients out there and even the injectors out there that might need a little bit of finessing with their words and how to deal with these very common questions in a very fast-paced, evolving aesthetics world. How are you, Mel? How's life?
I'm great. How are you doing? How are you doing? You're so busy all the time.
Ooh, today I have a cold and I put on the Max makeup and my face is puffy and I have it in a ponytail and I'm here and we're wrapping up our second season. I'm good. My training world is blowing up. It's in a good way. I'm training a lot of injectors around the Bay and flying to LA for some more trainings next week. And then I have a busy clinic schedule. I'm on the plated advisory board and it's just insane. So, trying to pet the cats, trying to stay married, just doing the basics. How about you?
I'm good. I'm good. I'm working at my new clinic and I love it. I'm working in a really small practice now with like an established, my boss is this amazing entrepreneur and we have a small group. It's only like 7 or 8 of us in the office. Like it's mostly like really high-end facials, but I'm loving my job. I'm getting all these new patients. And then also a lot of my long-term patients are seeing me as well. So everything's going great.
You look great. You look happy and amazing. And
Really? Thank you.
you're gonna be my celebrity connection down there in LA.
Thank you. I finally found like a hairdresser that's like amazing. So maybe that's why. I don't know.
I don't
But
know.
thank you.
I was looking. Your hair is like amazing. All right. We have to give each other compliments when we can. I mean, one of the most sad things is I'll give somebody a compliment in the room and they're like, no one has ever said anything. And I'm like, oh my God, be nicer to
That's
us.
so,
Be nicer to ladies. Let's give each other compliments, like
yeah,
little
I think
things,
and little
you
things like
know?
that really matter. It's like, always look for the positives and not like we can all look in the mirror and be like, oh my God, I'm hideous, which I do. And I'm actually like, I haven't gotten like filler or injectables as much as I used to. And like,
I haven't either.
I feel like my face is melting away, and you can like see my like 11 lines, even though I have
We need a
like
trade day.
neurotoxic. Yeah, we do. So anyway,
Yeah.
but it's good. Sometimes it's good to go that route and then get a makeover and you feel amazing.
But you look amazing. Let's give each other compliments as women. Let's help. But today we're going to go over just I just did a rough draft of like common questions. And this is still a trending topic. It's kind of because I see so many kind of silly questions from not silly, but like they're relevant questions. It's just like there's so much confusion online still. So I'm like, sorry if I'm leaning over. I'm trying to feel cozy today. But today let's go over some of the topics. So we can do it together, Mel. Is Botox preventative? I still get this question. Of course it is. What do you think?
I think it definitely is. I think that you're just not moving your muscles as much. They're relaxed, so you're not making those deep lines as quickly. I think that a lot of people, people that have been doing it for a long time, like all these celebrities, all these beautiful women that look amazing at 60, it's because they started doing Botox 25 years ago when it came out on the market 22 years ago or whatever it is. So yes, it is preventative.
Yeah, if you can prevent a deep line, it's preventative. So
Right.
boom, that one is
Mm.
still get that one. But yes, I mean, I think the best time to start is when you're seeing like a faint line that's not going away at rest. Like that's probably the best time. And I still get questions actually, what's the difference between baby Botox and Microtox? And let's do that one really fast because like came up yesterday and everyone's confused. They're just like, what? Like,
Well,
what is
you answer that, girlfriend. I don't, I know what the two are, but I use the words interchangeably. But what are your thoughts on that?
Well, I mean, baby Botox is just a lazy name for less units of a neuromodulator, like when we're just doing like a low dose. So that's that. Microtox is like a actual technique of a neuromodulator where we're putting it into the skin to help texture improvement rather than saturating the muscle. And it's often like hyper diluted where we add more saline so it spreads more and helps the skin quality instead of like really saturating the muscle. And I usually use that more in the neck and like extended crow's feet. But some, yeah. So that those are those, but they are confusing for people because these are just terms that like us injectors just kind of made up, you know?
Totally. I agree with both of those. Like baby Botox is like something like under 30 units. Baby Botox, it starts with like younger patients when you're first getting it. And then the microtox is when you do micro aliquots or
Yeah.
micro injections. So you're going to have like a lot of them little, they look like little candy dots. But yep, I agree exactly those definitions too.
Yeah. And some people are doing like what they're calling it microtox even on the forehead. So it spreads more, but maybe not going as deep, but then it wears off super fast. So, just that's why it's good to know what's in your face, keep a diary. And those are the terms for patients confused. So now
Yeah.
let's go over will filler make me look done or that generic filler look? Now, we've gone over this many times, but it's still a trending topic. Filler's only going to make you look done if like you want it to look done and your injector has maybe not the best aesthetic.
Yes, if you right. Especially I've been teaching my patients and just when I'm going to all these trainings in LA, which I think all injectors should go to and all people in aesthetics, even if you feel like you're the most trained, I am the best injector, you always go to those because you'll get a little pearl, like someone will tell you their secret technique. So I always recommend people that have years of experience to continue going to
Yeah,
trainings.
you're never smart enough as an injector, and once you feel you get too cocky, like shit hits the fan. So you got to be humble.
Yeah, just
Like,
always go. It's like you got a free dinner and like
yeah,
you're it's also good to make relationships with people in our
yeah,
industry. It's like these people
connections.
are like, I don't need to go. Like I'm amazing or else,
Yeah. I learned like
yeah,
something every training, even from my new injectors, like little tiny things, either how to phrase something or even something as simple as like the other day I was doing just like Nefertiti neck lift with Botox. And we're, basically on labels to go under the jawline where I used to go above the jawline. But under the jawline is like a little, you don't want to bruise someone up too bad. So I basically just pull up the skin and then do it on the jawline and drop the skin and it's perfectly under. And I'm like, why didn't I think of that before? It's so easy. I love that trick.
amazing. I love all these tricks, like
Yeah.
exactly like these little like
Makes my
pearls
life
that
way
you
easier.
yeah, like you learn your technique and then, you know, you teach it when you're around your colleagues. It's always good to share information because we're all team members and mates here.
Yeah. And I think with filler, there is definitely some buzz around like doing less filler. But the thing is if you have a really experienced injector, like, and the filler is placed in the right plane, you can do a good amount of filler and look extremely natural. And you won't have problems in the long run because it's placed in the right anatomical plane, meaning not in the muscle.
Yeah, that's
So,
so smart.
yeah. So, no, you're not going to get the filler generic look if you have the right injector.
Yeah, and someone in LA, like I'm learning again, this I went off the thing,
Yeah.
but what I was learning, it's always good to do it in your periphery. People look fake when they get these
Too
apple
much.
cheeks right here.
Hmm.
So look to actually where you are losing volume and you can see where you look different and you just don't always need to put it in your medial face.
Yeah, that's a really good thing. It's exactly what I tell patients. It's like our face, like on the periphery, starts to collapse in. So if we can, like a youthful face is actually like a wider face because our skeletal, our skeleton kind of like everything shrinks. So
Hmm.
the periphery is definitely the way to go, and the least product in the mid part of your face is probably the best way to go too. I love that. Okay, if I sleep on my side or directly on my face, will my filler move? No.
Yeah, I don't think so. I'd say, yeah. What do you, when you do your trainings, what are your teachings?
Filler, we know that filler can migrate, and there's a lot of discussion over this topic, but the migration is more like muscle movement over time and incorrect placement of the filler, as well as overfilling a certain area. So it's really placement and amount, not so much like what you're doing. It's really your injector's technique. And I hate to say that. That the muscle activity, like if your filler is in correct plane, like in a muscle, then like most of the time it doesn't cause a problem. But if there's too much in that area over time, that muscle can kind of pump it up to the surface and it will look like maybe a little bit more puffy or migrated. But as far as I know, sleeping on your face on the side, that's what I do. I can't sleep on my back. I'm not a back sleeper.
Hmm.
Your filler is not going to move from your temple to your jawline from sleeping on your side. And
Yes.
that same night, like if you get filler and then you sleep on your side, yes, you might be puffier on that side when you wake up because you have all that pressure and more blood flow to the area and a little compression, but it's gonna go back to where it was in that space. So,
Hmm.
just don't make your life harder than it needs to be and just
Yeah.
get some sleep.
Especially like in the temple and the cheek, you kind of want it to spread a little bit. You don't want just like a huge bleb of it right there. You want to have it smooth and spread out and onto the bone, or, into the subcu space.
Yeah, I agree. So, same with Botox. People are like, oh, I need to sleep on my back tonight. I mean, I think the most important post care with Botox is don't like sit in a sauna or do the day of, like right after, or do yoga where you're like upside down for an hour, or like get a facial or a massage, or wear like a really tight like hat after if you do your forehead.
Hmm.
But besides that, I think the rest is a little excessive in my opinion, and I've done everything wrong and I've been fine.
Yeah.
I think these are general guidelines. So it's just some of the things don't have a lot of science in the post care and like they're general guidelines, but you just have to like it takes like a few hours for the Botox to latch onto the muscle. So for the next 12 hours, I'm generally like, yeah, maybe don't massage it really hard. Don't do like a yoga class, but like you can do a facial like in 24 hours. You could do yoga, you could exercise.
You can go
So,
walk your dog. You can go for like a long walk, like right
yeah,
when you get home. Yeah.
yeah, our life is too busy to like be dictated by your cosmetic appointment.
Hmm. I
Sorry,
agree.
I'm a little sarcastic today because I have a cold and I'm just like
Mhm.
trying to, but these are things I hear every day. How many rounds of Sculptra do I need? So this is actually a hard question because it's variable depending on the person. Back in the day when Sculptra came out, like we used to really say everyone needed like three sessions, two vials each, spaced one month apart or 2 months apart. But that was for people that were like really hollow and had a ton of volume loss. And now we're realizing that Sculptra can be a very preventative tool, even for patients in their 20s and early 30s, just to like build collagen well into like decades afterwards, where it's super preventative. And those patients might only need one round of Sculptra, 1 to 2 vials, but generally, it's like a vial per decade. So I'm 40. I've had 4 vials. But it also depends on what your baseline is. Like if you have a really full face or you have a lot of filler in your face, we're probably not going to do as much Sculptra. And so, what do you usually say in your practice, Mel?
I usually say one session, one round is very subtle. So if you're looking for a huge transformation and like revolumization, you're going to definitely need I always say 2 sessions makes a huge difference, and you're really not going to, you're going to look great right when you leave because you're going to have the volume, right? Come back in when it's, and then while it settles, you're going to go down and not look like anything is done. So I usually say 2 sessions of, two vials for the whole face. Again, it depends. I did a younger patient who had good volume last week, and we only just did 1 vial. And then I'm gonna see her on Monday. I just massaging, I think, is the most important with Sculptra. But I'd say like 2 to 4 vials over 2 sessions.
I like that. Yeah, I think once you hit 4 vials, you're looking really good. 2 vials is
Yeah,
preventative. And then
yeah,
like 4 to 6 or 4 to 8 is like very volumizing for most people, which most people
yeah,
don't do more than 6, in my opinion.
right.
And then,
And then like 1 vial every few
yeah,
years, or one to
yeah,
2 vials every 3 years, like we did, like to just maintain
maintain.
it.
Yeah. And that's the other thing is like, there isn't really a guideline of after you've created your volume of how much to do. It's kind of up to your injector and to be continued because we're using so much more Sculptra now that like we don't really know the guideline of how to maintain. It could be a lot less than we think. So,
Hmm.
but yeah, that it is a technical question. Well, we've gone over some of these before, but let's just, since we're on the topic of Sculptra, what's the difference between filler and Sculptra? I mean, I still get this question, even though it's like, in my head, it's clear as day. But for the newbies out there, you can take this one. What's the difference between filler and Sculptra? I'm sure you get this question.
So, yeah, so filler is a hyaluronic acid base, and you will see the result right away, and it's a gel-like substance. And then Sculptra is a biostimulatory. It's like filler, they say, so it stimulates your own collagen when it's placed in your tissue, and it lasts a lot longer than HA filler, and it's non-dissolvable for the most part. So Sculptra is it helps skin quality, and it also can help volume loss. But HA filler, you see the result right away. And it's done you can do HA filler in the lips and in the tear troughs. And those are places that I do not recommend getting Sculptra.
Yeah, exactly. I mean, Sculptra has some limitations. We don't do it forehead, nose, eyes, lips. And I think it really shines in the periphery of the face to tighten because it can build volume in the periphery and it can actually like help the density of the skin, which helps everything from collapsing down over time. And then, like you said, filler is hyaluronic acid, which it's funny because when people are like, I only want things that are natural and I don't want filler, it's like, it's so interesting because filler is natural. It's like literally hyaluronic acid. It's something that we already have it's made to be bioidentical to what we already have in our body. I mean, the only difference is there's little extra proteins that that are added in the lab when they're made so that your body can't break it down as quickly, which makes the filler like what's called cross-linked. And if you were going to have a reaction, it's typically to the proteins, but not the actual hyaluronic acid. And so, but whatever. Um,
Yeah. It's dissolvable
yeah,
if one doesn't
you
like
can
it, and it's
dissolve
a
it.
great way, yeah, to do some filler first, or else I'm saying with all of this filler fatigue and the
Hmm.
fears and all that, I have them do like PDF first and show, like they're like, "Oh my God, I look so amazing." I'm like, "If you like
What's
this, then
PDF?
filler."
Oh,
PRF, I'm sorry,
PRF. I
PDF.
was like, what's that?
PDF,
God, another term? I'm
PDF,
like, ah.
PDF is a file, sorry. It's a PRF,
Gotcha.
platelet rich
Yeah.
fibrin. So I literally do that all week.
Yeah.
And so like I do that literally every single day,
Yeah.
like easy gel and stuff. And they see what they'll look like with volume again, and then they can get filler.
Yeah. I like PRF, the Easy Gel. I think there's finally like a study that came out with it that shows that it does add volume over time because we weren't really sure. But I remember like my patients that are really consistent with it. I kept thinking like I've seen these patients for like 3 years and all they do is like PRF every 3 months. And I was like, dang, like your under eyes, like you look good. Like I could tell they had a little volume, whereas they should have been like degrading over time. So I actually think it's really powerful, the PRF. And now we have research to prove that. They just came out with a study on that. So
I saw that. I saw that. Yeah, you have to do a lot of the
Yeah.
treatments to make it long lasting like that. It's like, but it does work because it's boosting your own collagen. It physically does that. So I agree with that.
Amazing. Okay, so let's see. How long will filler last? I mean, we went over this last time. It's still coming up though. I think on MRI it's anywhere from 10 to 13 years depending on the placement of the filler and the most recent study. So really, and it depends on your metabolism. Um, Filler can last a lot longer than we thought is like the general consensus. So I still have a few people that are coming too frequently for lips, and I'm trying to be like, no, you need a drop. Don't do it. But we that's where we come in as educators, and definitely under eye filler lasts forever. I mean, I've had this in for 7 years, and it's still pretty good. Yeah. So
Oh, it's the stuff I put
yeah,
under your
yeah,
eyes
you
like
did
10
it.
years ago. That's awesome.
I can be
Amazing.
your test. And I've even dissolved some of it, and it's still there. I'm like,
Yeah.
all right, this is good. But yeah, filler can last a lot longer than we thought. Sculptra, how long does Sculptra last? I mean, FDA approved for 2 years. That's when the study ended. But in reality, like the collagen that you make can last like over a decade, and the fibrosis of the skin can last like over a decade as well. So, it unless you lose a lot of volume, maybe you'll need some more treatments, but I think it lasts a lot longer, and that's why it's very popular and preventative.
Awesome.
How many rounds of
Very
Sculptra have you
cool.
had, Mel? Do you know?
In my life,
Yeah.
so we did some together in October, but the first rounds I probably had like two big, two vials times two, like two sessions over. And then I probably had one or two vials. I've been working in aesthetics for 8 years. So I probably had
Five or
like
six.
six
Yeah.
vials. I'd say six
Yeah.
vials over time. And I honestly, I could use more. I honestly feel
But
like,
you haven't done much filler
especially
though.
I
Yeah.
haven't. I don't. I have like I hardly ever get filler. I do feel like my face is kind of like wasting away. I mean, on camera, cameras always make people look better, when I have makeup on and stuff, but like my temples are like starting, and you can't see it cuz like cameras make people look better, but I can like feel, you can see my like line, my temporal fusion line. I mean, I don't know. I feel like I'm almost 50 years old, and estrogen
Yeah, the
loss and all
estrogen
that fun
stuff.
stuff. You can feel your volume go down when like your
Yeah.
estrogen's
Are
like
you on any hormone
done.
replacement or no?
No,
No.
I not
Okay.
yet. Not yet. Yeah,
Yeah.
not yet. I want to be, but my
Yeah.
GYN thinks I should wait a little bit
Yeah, that's
longer.
the other trending topic. Hopefully, I can have someone on who's a hormone expert to help us all. I'm working on that, you guys, because I know that's like a hot topic.
Yeah, yeah, yeah,
But
for
yeah,
sure.
so all right. And then the latest thing that actually has been trending that I've seen is like what kind of Botox is in your face. And people are really curious with the different brands of Botox. And I'm kind of like, I'm an expert in the three that we carry. The other ones I don't really do, but like I could at least like give you a rough guideline of what they are. And my suggestion to patients is ask what kind of Botox they're using, because unfortunately I have no proof of this, but I've heard of this, is some clinics are using other things rather than Botox and calling it Botox. And just
Oh
because
yeah.
it might be cheaper for them to get. And it's good because each type of neuromodulator is slightly different. And I think you're missing out if you're not really, if you don't understand the nuances of it, or if you're not happy with your treatment, maybe try a different brand. But we carry Botox Dysport and Daxify, and is
Us
that what you
too.
carry? Yeah, and I think that's like the
Yeah.
most common in most clinics. There's also Xeomin, Jeuveau, and now there's a new one called Ledibo. I don't even know if I'm saying it correctly, but it's from Korea, and now it's just starting to come to the US. I think it just got FDA approved. I don't know much about it. I know that it's a lot cheaper. I don't know how it compares.
Oh yeah, is that the oh wait, that's where people like are like, "Oh, I got it in Korea
Yeah,
and it was $1 a
exactly.
unit or something like that." Oh, so that's gonna
It
be in
just, yeah,
America
it's,
now
I think it's
too?
FDA approved. So
But it's probably gonna if it's $1 there, it means it's gonna be
yeah,
like
yeah, still going to be
$5
more,
here or something like
yeah,
that. Yeah.
but I don't know.
Oh yeah, is that the one that lasts for just 2 weeks or no?
No, that's
No, there's
like,
a new one
yeah,
coming out
that's
that's
gonna, we're gonna have a lot of different neuromodulators, but there is a new one in the making, I think, or it's like approved in Europe. It's always approved in Europe, but I don't have a lot. I've heard about it.
right.
It's like a test drive. But yeah, so there's a lot out there, you guys. And if you're seeing Botox on the market for pretty cheap, it's probably not Botox. And the other thing that's kind of getting wild is like how people are diluting their products. And it's getting kind of like, and it's not that it's wrong. Like it's really not wrong. It's just like if you're hyper diluting your products, it's only going to last probably 2 months max. And so you want to know like how your injector is diluting. Like on label for Botox is 2.5 cc, and if you're doing 3 cc everywhere, then it's probably not going to last. But that's okay. If that patient wants a really subtle result, then like good for you, but just make sure you're not paying like an arm, like paying a ton of money for it.
Right.
I don't know.
Well, they shouldn't do that. They shouldn't do that. That shows that if it's, occasionally our metabolism will be high or we'll be stressed or we'll be working out crazy and your neuromodulator won't last the 3 to 4 months. It happens to everyone
Yeah.
occasionally, but if it happens, if you go to the same practice and it's happening like that, like straight, then
Yeah.
I would try a
Try a
different
different
brand
brand or
or
like,
see,
yeah, I mean, I just think it's
yeah,
so confusing with everyone saying that their neuromodulator is wearing off because it has to do with so many factors. It's like, how much weight have you lost? Do you have a thyroid issue? How many units are you getting? How is your injector injecting you? Like, are they in the muscle? Are they superficial? Like, what's the dilution of your product? Like, there's so many factors. Also, people with chronic migraines, like, you want to do your cosmetic Botox within the same window as your migraine Botox, because if you're just jumping around and doing it every 2 months or every month, then you're probably going to build up a little bit more of a resistance or antibody. You know what I mean? So it's like that's something that like we don't really talk about as much, but it's happening a lot. So there's a lot of factors to all of these issues, and also what product are you using? So I just think the dilution has gotten a little crazy out there because everyone's diluting things different. And I do too.
yeah, that's annoying. No, can you tell me about this? Because I just do it the way we were trained at the
Yeah.
same practice. I do it the
I do
on
too.
label.
Yeah.
I do like 2.4 because
Yeah.
it gets cut stock in the syringe or whatever. Like I don't want to go over.
Make
I want
sure
to
it's
make sure it's the
concentrated.
right.
Yeah.
But like
Hmm.
what yeah, but what are your thoughts on these injectors that do like different dial 1 to 1 here, 2 to 5 here, 5 to 5 here? What are your thoughts on that? To me, that really frustrates me, and I'm like, I just do it on label. But what are your thoughts?
Well, you might be frustrated with me then too. I mean, I'm kind of an artist.
Well, then why? So why do you do it that way? And like,
Um,
what are your what do you? I want to
yeah.
learn because if it's amazing, then I will. Do you find that it gives a better outcome that way?
I do my Botox. I have one vial of 2.5 mLs, which is on label because the 2.5 will spread more and saturate an area nicely. So definitely a forehead 2.5. Crow's feet, you want it to spread. I don't want that spread though in the DAO because I could have a crooked smile. And on some patients that already have hooded eyelids, I don't necessarily want that spread in the glabellar. Definitely, I'm always doing the lateral corrugator 1 to 1. Like I do 1 ml dilution there because this is the only area that can really drop an eyelid, like tried and true. And I want to be as safe as I can. And then the DAO, I always do my 1 to 1 dilution here, unless it's a really strong, meaty muscle. But even if it is, I have higher units. But sometimes I can get away with people that say that they feel heavy to the medial frontalis or the medial glabella. It's just like your 2.5 dilution is spreading too much, or your injection technique, you're injecting slightly high and it's hitting the frontalis at the same time. But if it's like a really thick strong muscle, you can't do a 1 to 1 because that it won't spread enough, and then the patient will be kind of annoyed that it didn't work. So it's definitely a more advanced like technique, but I feel like if you are advanced, if you're really advanced, it helps me, it gives me peace of mind that I'm not going to drop an eyelid and I'm not going to have a crooked smile, and it makes the chances lower. Is it more work? Yes. It's a little bit annoying, but like I'm used to it now. And then my Dysport, I do 1.5 dilution, on labels 1.5 to 2.5. The 2.5 is sometimes better for the frontalis. So if I'm doing like a man's forehead, or just a really like a larger forehead with a lot of lines, the 1.5 dilution might not spread enough. So I might make it a 2.5 or just add some more saline. But in general, the 1.5 I think works really, really well. And just because Dysport spreads a little bit more than my Botox, I don't have any issues with it. I think it's fantastic. Injectors that I train get really confused with like, the how much to put in each space compared to the 2.5. And then there's a lot of injectors doing a 2 ml dilution for everything. And then I get confused with that because I'm like, what? So, and then I've had people that are doing a 3 ml, and I'm like, oh my God, you guys, I am
Dude, I'm
lost.
sorry. To me, it's annoying. I haven't had problems doing the
Yeah.
on-label way, so I'm going to continue doing it. Like, unless, I mean, if someone maybe you can do my face with all of your different dilutions, and is there a difference? Is there like it's just preventatively from dropping and
Um,
stuff like that, or does
I
it
think
look
it looks
better?
good. I mean, I'm an artist and I want perfect like results. And I think I can saturate a
Hmm.
muscle more effectively with more units at the 1 ml dilution and higher risk zones, especially on the lateral eyebrow. I can get a better
Hmm.
lift because I can put in like a higher I
Good
can
to
put in
know.
a higher amount of unit without the spread and the risk of an eyelid drop. So I'm getting a stronger, better result.
Got it.
So
Like a higher lip. That's really good
so
to,
I
I'll
do,
practice that. So the
yeah. So I
lateral,
do think that really did change my game. And because we do so much neuromodulator, I want to have perfect results. But
I'll try that. I'm glad you're this is why I want to know like the rationale. And I get like to put it in
yeah,
and not have it spread, but I'll try it on here. I'll try
yeah.
it on here. So
But
here
it's
in the
not like
DAOs
anything's
you're
right or
recommending.
wrong. It's kind of just like I always inform the patient and make sure that like, everyone's doing off-label use of a lot of things, and you just want your patient to be aware of that and have expectations on the longevity. But really, having the 1 ml dilution should last a lot longer because it's more concentrated if you're using certain things. But so yeah, I think there's definitely a method to my madness. Um, I just have seen, I think a lot of injectors are just doing what they're taught and they're not thinking through why you're using what dilution where. Or if people are getting Jeuveau and people are calling it Botox, I'm like, that's fine because it's very similar, but educate the patient on why the price is cheaper, and don't blame us that our prices are too high. It's a different product. It doesn't have the same like, maybe research and study behind. So anyhow, sorry for all my intensity today. Um, okay, this is a common one. Can you give me a brow lift and remove all of my wrinkles on my forehead? So if you're young, maybe, but at a certain point, our brows start to shift down. And, we want a brow lift, but we also want a smooth forehead, and something has to give. Right now, I'm very smooth. I have no lift because we overdid it, and it's fine. I'm accepting where I'm at today. Um, so I usually do like a little bit more motion in my lateral brow, but I can't have both. I need to either pick a little motion on my frontalis to lift, or I'm tight, and like tight as all hell. So at a certain age, you can't have both unless you have an upper blepharoplasty and a forehead lift. What are your thoughts, Mel?
Mhm. Yeah, I mean, so you're frozen in your forehead right now, you're saying? Like you just have a lot of toxin in your
Yeah, and I didn't get
face?
as much lift because I don't have any movement. So it's like, so if I had a little more
Got it.
movement,
I
I'd have
see
more
what.
lift. But sometimes I try new things and
I don't know. I mean, I can see. I think if as long as you have to just wait for the lift, get the lift, and then come back in 2 weeks. And if you want to add a sprinkle in your forehead, you can do that. If like you're lifting, if you're Yeah, if your brow lift is your number one choice, just do a really small amount in your forehead
Yeah.
or come back once you get the lift and touch that
Yeah, it
up.
might be
That's what
more
I
of a
would do. That's what
two-stepper.
I do.
So that's why it's good to check in at 2 weeks. Because once you like freeze, or not, I hate the word freeze. Once you eliminate most of the movement on the forehead, it's harder to get a lift. There's not much you can do. Although there's a recent study of like adding bacteriostatic saline to the area that you can potentially break down a little Botox more quickly. And I've trialed that and it seems to help actually. So if somebody say that I'm a little bit too tight and I want more movement, I could put some normal saline, and the benzyl alcohol within the saline can actually help break it down a little bit more. So it's kind of cool. Yeah, it's a cool trick.
Interesting.
Or
That's
I
very
could
cool.
add like
Very
my
cool.
1-to-1 dilution, 1 ml in the 100 units of Botox, and add it to the lateral brow just to give it a stronger
That's so
lift.
cool. I'm going to do that this week and I'm going to tell you
Yeah.
how it works out. That's such a cool, that's your little, those are the pearls that I'm
Aw.
talking about that you get in
Yeah.
trainings or in meetings where you just learn someone's trick and like bring it into your practice and
Yeah.
vice
So
versa.
we're learning today. I think that kind of wraps up
Those
some
are
really
good.
intense
Yeah.
questions. I have Yeah, I
Yeah. I
have
think we
more,
did
but
great.
that I think is like pretty common, what's going on. And so, give us your questions, DM us. I know in the clinic, I kind of like see what's on trend just by your guys' questions, and it helps me be a better educator. So, thank you. We're going to wrap up this episode, and thanks for being on, Mel. It's always good to see you. Bye.
Love
Good
you,
to see
girl.
you.
I'll see you soon. Bye.
For our latest news, follow us on Instagram at aesthetics.unfiltered.podcast or in our personal pages on Instagram.
Mine is melanie.skin.np and Michelle skin.smarty.np, both on Instagram. Have a great day.